So here I'd like to briefly talk about small intestine 11 and small intestine 12. Small intestine 11 is located about 1/3 the distance between the upper portion of the scapular spine and the very bottom portion of the scapula. So about 1/3 of the way down and about halfway between. So when you palpate around here for this point, you'll feel yourself you'll feel your finger fall into a depression there. And this is right into the infraspinatus muscle. And then small intestine 12 is just above the scapular spine, but below the clavicle in this fossa here, which is where the supraspinatus muscle is. Now I mentioned before with small intestine 9 and 10, you've got the teres minor muscle that moves through here. You've also got the influence of the serrator and serratus anterior, as well as the latissimus dorsi muscles. But the infraspinatus muscle here, which is inside and under the scapular spine and within the scapula over really the whole scapula itself, as well as the supraspinatus muscle, which goes right along the top of the scapular spine. These muscles are extremely important as stabilizers, which also help us to extend and grasp with power. But this is also a big sea of muscle that when a person gets stressed out, when a patient is really tense from overwhelm of work, from too much stuff that's calling upon their attention, they've got too much to sort, right? These muscles are going to get very stiff and generally very sore upon palpation. So these are phenomenal points to do together. You can, like 9 and 10, I do these together as a pair. That's called a Dao Ma pair. And I will needle these perpendicularly. And you can needle these a couple of different ways. So one is you can needle them together and then add E-stim at a very low hertz level, about 10 hertz, at a very small amount of stimulation, because again, we just want to loosen up the muscle and get qi and blood to move through this area. And when you invigorate the blood, you expel wind. And when you invigorate the blood and add more qi circulation, qi is warming, so that expels cold, right? So these are points that you can do with E-stim together. Very nice pair. And generally I do that for, if it's super tight, maybe about 10 to 15 minutes. If it's just tense and stiff, with a little bit of soreness, then maybe about 5 minutes of E-stim. Another way to needle these points is perpendicularly, and then I add moxa on the needle. That's particularly helpful if there's a lot of pain and toughness in the region upon palpation. So when you're palpating these points, the tonicity of the muscle is very intense, it's very tough, it's very tight, it's very unyielding, right? And that generally implies that there's probably some cold in this area. It may even actually feel cold to the touch. And so when you relax these muscles, you are helping to loosen the qi and blood flow through this whole upper back region, which will be supported by the next points that I'll do in the next video on 13 through 15. Another way of treating these points is a different needling technique, which is to help expel wind. And that's a circular technique. So I would probably start with 12 first, and then I insert the needle. And so after inserting the needle, roughly about maybe 3 to 5 fen, I'll start to make large circles in a counterclockwise motion, getting larger and larger and larger, and then pulling the needle out. So I insert, I make a circular motion, almost like you're stirring up the wind, you're catching the wind and then pulling it out. So it's simply like putting the needle in, and then you move in a larger and larger circle and then pull it out. So that's a technique that you'll learn in the 7th trimester in the Advanced Needling Techniques course. But this gives you a sense that we can use needles in a way that helps to address directly the climatic factor that's become a pathogenic factor that's invaded into this area. So these are nice ways of treating these points. And this is, of course, a place where a lot of people hold their stress and hold their tension.